The best way to avoid complications is to understand the pathology that you're treating, understand the technology that you're using, and to have the ability to treat and recognize any complications that might arise. Now, if you don't understand the pathology of the condition that you're treating, you're not going to be able to adequately treat it, and therefore you can run into complications. In terms of understanding the technology, you need to know what's happening on a basic physiologic level. One strong clue for that is to look at the endpoints that the laser is producing, and I'll give you 3 examples. When you're treating vascular lesions or telangiectasias, you want to look for vessel clearance, transient bruising or purpura, or bruising as your treatment endpoints. You don't want to see graying, you don't want to see whitening. With treating tattoos or pigmented lesions, you want to see tissue whitening. What you don't want to see is splatter, where the epidermis is really being destroyed completely. And then finally, with laser hair removal, what you want to see is perifollicular erythema and edema. That's around the hair follicle, redness, and swelling. By sticking to those treatment endpoints, you can ensure that you're getting effective and safe treatments. Finally, you need to be able to recognize the morphology and/or the clinical appearance of certain complications. For example, if you cannot recognize the appearance of disseminated herpes, you will not be able to recognize and treat it quickly, and that's a complication that can happen with facial treatments. If you activate a herpetic infection and you're using a resurfacing device, you can spread that infection throughout the face, causing a very high risk of scarring and real morbidity to the patient. So to summarize, you need to recognize the pathology of the condition that you're treating, understand the technology that you're using to treat, and you need to recognize and treat basic complications.